There's an ordinance that says you can't smoke in public, period, in the city of Santa Barbara.
Right, okay.
You know about that one, right?
The streets are home to 1 million homeless stories, and Officer Keld Hove has heard them all. Over 20 years on street corners like State and Haley.
He doesn't have a plan that's going to get him out of this predicament so that he will be somewhere else tomorrow. So he depends on other people stepping in and helping him.
And then there is Earl.
Earl, how are you?
Who Officer Hove calls his very first intervention.
I arrested him to get him in to get medical attention, and then after he got sobered up inside of the jail, then he was able to continue with his sobriety, and we got him housing, and he's been sober ever since.
I know he's one of the good guys. There are good guys.
Officer Hove has a stick and carrot approach to helping. He can cite someone for drinking or smoking in public as a way to force them into restorative court. But with full cooperation, the fines are waived.
After 6 months of working with us and perhaps living inside or being in a program and have given law enforcement no grief for that time, then we drop those tickets and it helps them move on to the next level, which could be housing somewhere, etc., etc.
In less than an hour at one intersection, Hove introduced himself to someone new in town. He offered help to this man with his nuisance citations and finding a shelter, and just stumbled across another man he helped years ago reunite with his family in Philadelphia and get a room at Santa Barbara's Fieldhouse Hotel.
Yeah, I just go to school and live here.
Okay.
Good.
Thank you.
Other than that, I will try to get another job.
I know you.
Thank you.
And as you go along with this job, you realize how many people are struggling in so many different ways. This is what we have to do. We didn't ask to be dealing with mentally ill people, but they automatically come to us. So we can look at it as, do we punish them through law enforcement only, or do we see if there are other options? And that's what restorative policing is all about.
Treatment programs, reunification with family, and finding permanent housing happens when someone is motivated to break out of their destructive cycle. Such is the case with Frausto. She's been clean and sober since late 2017 and is dedicated to her physical therapy for a stroke she suffered.
AmeriCorps is the one that helped me get into this program. Because if it wasn't for them, I would still be homeless. Or I'd probably be dead because I'll probably be out there still using drugs.
She has broken the cycle of going in and out of jail and has found housing at Hotel de Riviera.
And I got my family back because I'm sober.
Jessica Lucas was a member of AmeriCorps when she began helping Crystal. Now she is with United Way's Home for Good program, which housed 21 homeless last year and reunified 16 others with family. On this day, she's trying to find housing for Donald Swan, a homeless veteran for well over 2 decades.
I know, I'm concerned, Donald, because you're not going to your appointments. And at PATH, at least they're there to make sure you're doing okay. There just isn't enough housing to get them into housing quickly, especially people who have pretty significant disabilities and can't walk upstairs. I would say the common theme is that they didn't have a safety net. There wasn't anybody else who was trying to engage with them because they weren't staying at a shelter, they weren't working with anybody. And so our goal is to be that safety net for the people that don't have that to begin with.
And Jessica has over 24 people at a time that she works with one-on-one.
All right, so what do you want me to say tomorrow at court? I'll say, I object, Mark's the best. Don't arrest him.
Yeah, I know what to say. Just be there by my side.
I got everything to live with here.
With the help of Jessica and others, Vietnam vet Jesse Goodman went from eating out of dumpsters for 13 years to living in a small trailer.
I got to the place that I thought that I didn't think there's no way off the street. They do that. They go around and they ask people that's homeless, can I help you? And I didn't know who they was, but I said, yeah, I need help. And she's been a very strong lady in my life. She would never give up. She's very persistent.
For a multitude of reasons, mostly mental and physical, many homeless are resistant to any kind of medical or housing assistance.
Travis, who's my supervisor, he works in all over like Santa Barbara that's not on State Street. And so he works with a lot of people who are in encampments, people who have kind of taken themselves away from the mainframe of Santa Barbara. And so they're a little bit less willing to work with us.
So the city of Santa Barbara applied for and received a $2 million Homeless Emergency Aid Program, or HEAP grant, to help and hopefully house the 50 most vulnerable individuals. They include the chronically homeless, veterans, seniors, people with health issues, including mental disabilities.
They may have mental illness, or they're veterans or seniors or youth, or maybe substance abuse problems. They become more vulnerable because they have more issues that needs to be dealt with, and maybe a little bit more difficult to get them into permanent housing.
A portion of the $2 million grant goes to CityNet, a Southern California outreach organization that uses a mobile team to go where the most resistant homeless live.
We're starting to find out that this approach of having like a mobile navigation center where people come from these teams, all they're able to help them, has absolutely been the most effective of getting people off the streets.
When you really do sort of kind of take a large, challenging societal challenge and sort of focus it down on a couple key individuals and sort of bring to bear all the resources on a relatively small population, we have seen the significant results. We've seen people who have been homeless for decades, literally, sort of finally get to that place where, because of this collaboration, they were able to get housed and actually stay housed.
It's a big task. At last count, there are nearly 900 homeless in Santa Barbara. Approximately 2/3 are unsheltered, sleeping in bushes, doorways, and other hiding places.
Get people housed. That's like the foundation that people need in order to start improving their lives, is to have a roof over their head, and then they can start thinking about, other services to help.
The Santa Barbara Housing Authority is just one cog in the HEAP grant collaboration, which also includes CityNet, Santa Barbara Police Department, PATH, and Cottage Health Systems.
What's important, though, is the connections that are made, the relationships with CityNet, with restorative policing, with Keld, Hove, and others, that make those personal connections with people to build trust, to say, let's get you some housing, and then let's talk about services as well.
People Assisting the Homeless, or PATH, typically shelter up to 100 people a night. You might say this interim housing facility is a path for homeless to recover, reunify with family, and ultimately find permanent housing.
They might be shy of coming into a shelter, so maybe coming into PATH isn't for them, but we're hopefully going to be able to work with those folks out on the streets where they are and still get them into housing.
As part of the HEAP grant collaboration, PATH makes beds available for Cottage Health Systems, restorative policing, and CityNet outreach teams.
So we've had about 4 folks come through already, 2 of which have moved on to more permanent housing solutions, which is exactly what this program was designed to do.
I mean, the reality is it's going to take truly a collaborative posture and a collaborative effort to really get all the right resources focused. We're better together. That's just the reality.
Assisting the CityNet outreach effort is a nurse practitioner from Cottage Health Systems, which also received HEAP grant money.
She's out with CityNet, she's out with the police, restorative policing, and she's really meeting with the homeless, building that trust, and then working on their medical care plans, working on their medication management, helping them connect to the primary care physicians, doing education, health education, anything we can do to help the homeless to be more healthy in our community.
Engaging the 50 most vulnerable homeless in the field could decrease their emergency room visits, which currently average about 3 a year per person.
I think part of the goals of the program are to reduce emergency visits, and I think what we're really interested in is providing the right care at the right time.
Cottage also provides a coordinator who brings all the agencies together periodically to ensure everyone is on the same page.
What we're trying to do is provide those services, the medical services, the social services, and all the wraparound services where we ultimately are getting them housed. Because really, having a home is going to be that key to success and to being ultimately really healthy.
So it's very individual. Just because you're homeless doesn't mean you fit in one box, obviously. If they are compliant, it's manageable. If they have a drug and alcohol problem, if they have mental health issues, if they have physical ailments that just compounded, then it becomes a much more difficult task. And that's where it takes a village to get that one person back on track again.